Hello, I'm Brad Burklow, and I'm a licensed therapist in Illinois. And I've got about 33 years of experience as a therapist and clinical director, clinical supervisor in the mental health field. And one thing I'll tell you is that therapy is a great thing, but in terms of my own personal life and my own sort of moment to moment wellness and mental health, nothing I have done has improved my overall well-being than cold plunges and saunas. I mean, I throw exercise in there, but the great thing about cold plunges and sauna is that you're condensing what I think would be 2 or 3 hours of exercise and getting the same kind of benefits in terms of endorphin levels and dopamine and those feel-good hormones. It's so much quicker and more intense than regular exercise. And so I'm here at Optimize You, where they have a cold plunge. They keep it at about 38 degrees. I just got out of the sauna. I started taking cold showers around the pandemic, and the problem with cold showers is if it's not in the middle of winter, the water's not cold enough for the health benefits to kick in. It needs to be under 60 degrees, and so I was looking for a way to keep having those enormous benefits that I was getting out of the cold shower. This is colder than a cold shower. It's more intense. Cold shower is probably 55 degrees, something like that, in the middle of the winter. And this is a lot colder. But what I'll tell you is that there's no bigger sissy when it comes to the cold than me, or there was. And so when I first started hearing about cold showers and cold plunges, I was like, I'm never doing that. But if I can get acclimated to it, believe me, you can too. And once you start seeing the benefits of it, the immediate benefits, that it's different than short-term dopamine bursts, which is, you get your ups and downs with alcohol or drugs or even good experiences. You get that high, and then there's a price to pay. You get a low afterwards. No price to pay with a cold plunge. It's not just like you feel good when you get out and then it dissipates over a few minutes. It lasts throughout the day. The energy levels, and the other thing I would say, it's really good for anxiety too. And life is external pressure, dealing with your bills, dealing with traffic, dealing with relationships. And so what this teaches you to do, this and the sauna, teaches you to be able to handle that external pressure and be able to stay calm under stress. And so I'm going to go ahead and get in the cold plunge here. Again, it's about the size of a bathtub. They keep it filtrated, so it's clean water. And see, we're about 4 minutes right now. So I'm gonna go. I usually go for about 11 and a half minutes, and then 2 minutes underwater. The response to cold plunge goes in stages, and so there's always an initial kind of exhilaration or shock when you first get in the water. But once you can clear that initial shock, that initial hurdle, there's a calming sensation that comes over your body. And And so when I first started doing this, like, that was pretty intense. Now it's not nearly as bad, that first shot. But then for about the first couple minutes, your body's still trying to get used to it. But after that, if you can sort of push through that wall, there's another sort of second wind, another relaxation response, where your body, the way I describe it, starts to feel a little numb. And the way I feel right now is I feel like my skin is cold, the outside of my body is cold, but inside I'm warm. So what you want to do, whether you're starting out with cold showers or whether you're doing the cold plunge, I always recommend starting out with cold showers, gradually exposing yourself to the cold. You want to try to keep your breathing steady. You never want to hyperventilate in the water. Some people do that Wim Hof method in the water, which you don't want to. You want to do a sort of slow, steady, deep breaths. I like to go in through the mouth, in through the nose and out through the mouth to maximize that nitric oxide. It's a miracle molecule, a feel-good molecule that helps distribute the oxygen to your entire body, to all the vital organs, and to your whole body. And so, just keeping those breaths steady and slow. Our bodies were not meant to be in 72 degrees room temperature year-round. Our bodies were designed to be able to handle stress. And so that's one of the reasons I think cold plunge has been shown to be good for the immune system, is it just works that cardiovascular system, that very complex cardiovascular system. It helps to make sure that's getting movement, and you're not just sort of frozen, not just stuck in that state of that parasympathetic state all the time. Your nervous system has two main parts to it. One is the parasympathetic, that's your rest and digest. That's the state that you should be in for most of the day. Some people refer to it as the brake, and the sympathetic part of your nervous system as the accelerator. But most of your day you should be in that parasympathetic state. So relaxed but alert is a state you should be in most of the time. And the more you can differentiate those two, so at least part of your day being in that parasympathetic state, hard exercise, cold sauna, and doing cold plunges, the better your immune system is going to be. You can fight off viruses better, and again, you can handle stress better as well. But there's a sign on the wall here that says anything over 4 minutes, you're at your own risk. You sort of gradually work your way up to 4 minutes. But I started out with 3 or 4 minutes, but I quickly realized that I could do more. And the benefits are dose specific, so more time in the cold plunge equals more endorphins. And so I don't shake when I'm in the water. Like I'm not shaking right now. I'm feeling really calm. But when I get out, it's interesting. When I get out, like I'll start to, right after about 2 minutes out of the water, I'll start to shake pretty significantly, and I was thought, well, that's bad for you. Shivering is bad. That means I'm going to get a cold or I'm going to get pneumonia or something. And when I started looking into the science of cold plunges, I realized that shivering is actually good for you. It produces something called brown fat, which is something that is a protector against the cold, and it's a good kind of fat. And so shivering isn't bad, and it's part of to me, it's part of the process, and it's a little uncomfortable, I guess, when you're shivering. I feel vulnerable, like I don't want to go into public places when I'm shivering like that, because it kind of looks like I'm having like a panic attack. But the shivering lasts for probably a couple minutes, and I'll tell you, like, when you start to warm up and I'll turn the heater on in my car, even on a hot day like this in the middle of the summer, and you start to warm up, it just feels so good. When I get home, I'll take a warm shower, and it's the most wonderful feeling when you're taking that warm shower after you've been in the cold plunge. Something similar is when I get out of the sauna. I don't drink water when I'm in the sauna, but when I get out, I'll take a drink at the water cooler, and it's the best drink of water that you could possibly imagine. I mean, the water tastes so good. And so it teaches you that no matter the more sort of pain or suffering that you go through, it's kind of like exercise. The more uncomfortable you are as you're lifting weights or jogging, the better the natural high is afterwards. And so same for the cold plunge. It's just a wonderful feeling, and again, it lasts throughout the day. And so it looks like I'm at about 8 minutes right now. I'm going to take a few deeper breaths as I get closer to that 11.5-minute mark, is when I usually go under the water for the head done. And so I try to take these abdominal breaths, we call them, and so focusing on the abdominal muscle and the belly going out on the inhale, and the intercostal muscles that line the ribs. Those are your two main muscles involved in healthy breathing. And so just let it fill up like a balloon. For about another minute, and the head done, and then I'm going to get out for the really good part, which is the after effects. And again, I'm not uncomfortable now. My feet are probably the most uncomfortable part. Your extremities are going to be the hardest, because the blood is flowing to your vital organs as it's trying to protect those, and that's why people get their fingers have to be amputated when you get frostbite really bad. But it's not unmanageable, the sort of stinging sensation in the feet, and I don't even hardly notice it anymore. But the rest of my body is warm. About 30 more seconds. You want to do the head dump. Well, let's do 30 more. Let's get enough deep breaths in. Head dunk is the best part, in my opinion. And again, after a couple of minutes, I'll start shaking, but that's nothing to be afraid of either, and actually enhances the benefits. And so, thanks for listening. My name is Brad Burklow. And you can access my therapy services on the ALMA, ALMA website. And again, I'm a licensed therapist in Illinois, and I accept all major insurance. And have a good day. Hope to see you next time. Bye-bye.